Hello, dear viewers, and welcome back again to Good Morning Kuwait. And our guest today is a highly qualified dental specialist with extensive experience in periodontology and dental implantology. She holds a bachelor's degree in dental medicine, a master's degree in dentistry with a focus on gum disease, and advanced diplomas in dental implantology for leading international institutions in the United States and Italy. Combines scientific expertise with a strong passion for sports and a healthy lifestyle. She brings a holistic approach to oral health, emphasizing the vital link between healthy gums, strong teeth, and overall well-being. We are pleased to have with us today Dr. Prashanthy Prasad, a periodontist and implantologist right here at Good Morning Kuwait. And good morning, and how are you, doctor?
Good morning, Kuwait. Good morning, KTV. Thanks for having me here. Thanks for the kind introduction.
Such a long CV. It's amazing, actually. You've been to the States and Italy. That's beautiful.
Basically, it's a credentialing program.
Yeah.
It's International Congress of Oral Implantology, and GCI is Global Congress of Oral Implantologists.
Amazing.
The credential programs where we get the opportunity to meet the renowned, phenomenal implantologists worldwide. So.
Amazing. So for our first question for today, could you briefly introduce us to the world and specialization of why periodontology is essential overall for oral health?
Yes, periodontology is that specialty of dentistry, or that field of dentistry which focuses on the health of the structures supporting the teeth. What are those structures supporting the teeth? They are known as periodontium. Let's consider now tooth as a house, where a house needs a foundation. Similarly, the tooth is supported by strong foundation known as periodontium. The main components of the periodontium are alveolar bone. We keep saying bone, alveolar bone, periodontal ligaments, cementum, and gingiva. Gingiva is known as gums. We say gum treatment, gum cleaning, so it's gingiva.
All right. So, many people focus on teeth only, but how important are healthy gums in maintaining a strong and lasting smile and making sure that your teeth is always intact?
A very great question to start off. Basically, the soft tissues which support the teeth, that is gingiva, the gum. So we can say those are the tissues which frame your smile. So those tissues needs to be healthy, definitely. And how do you know that tissue is healthy? It has a specific color. It's the healthy gingiva has a coral pink color.
Oh, okay.
And
so it's like pinkish orange in some way.
Yeah, a coral pink. And basically it shouldn't be a dark pink or a dark red gingiva. Bleeding gum is not healthy.
Yeah.
And the texture, it is firm. And it shouldn't be swollen. And it has a knife edge border, and it's not a rounded border. So these are the healthy gums which surrounds the tooth.
All right. So what are the early signs of gum disease that people often ignore? And, you know, sometimes people would actually feel the pain, but they would actually, as we said, ignore it for the longest time. Then it becomes something that is horrible, like bleeding or pain.
Yes, there's two versions of your question. Basically, I would like to answer like the early signs of gum disease. Early signs of gum disease is redness, bleeding while brushing. There is bad breath, swelling of the gums. You will see gums pulling away from the tooth, which gives you a long appearance of the tooth. There's also space between the teeth, and you will see over a time that this tooth was straight, there was no space. Now the tooth is moving, there is a small space which has created. These all are the signs that the foundation or the tooth supporting structures are not strong enough. And the second part, what you asked, like pain, I would like to say here, most of the patients they don't have pain for the gum disease. Basically, gum disease is a hidden disease. Sometimes I can say patient, often they get to know that they have gum disease when they come to the clinic, when they have the clinical examination and the radiographic examination. That is when they actually know that they have gum disease.
Oh, okay.
So yes, and ironically, there is another scenario where the patients who meticulously clean, they have gum disease, and the patients who don't clean, I've seen tartars and plaque, they don't have gum disease, surprisingly.
Yeah.
It's so gum disease is not just linked to your oral hygiene habits, it's also linked to your immunity, host, defense, response.
Genetics also helps a big role too.
Exactly.
Some people like have yellow coloration of the teeth, which is just genetics, and some have whiteness. Same thing with, as you said, let's say the saliva that's in the mouth. It's just also genetics. Some people actually have it, some don't.
Yes.
So when you don't treat your gum, what does it do to your overall health? Like not just the gum or the teeth, but overall in general. Does it link to any other diseases?
Yes, gum, as we all might have heard and seen, mouth is the gateway to the overall health, and mouth also acts as a mirror of health.
True.
So the gum disease is linked to many oral health conditions, especially diabetes. Many research studies from very long have linked diabetes as a direct relationship to gum disease. When you have an untreated gum disease, the bacteria present in the blood, it will pass through the bloodstream, and there is bacterial toxins known as endotoxins. This can pass via bloodstream, and it can impair collagen synthesis and tissue healing. So this is how diabetes is affected. One of the phenomena, there are many phenomena which explains what is the relationship between the diabetes and gum disease.
All right. So how can
yes, it's also linked to many other health conditions like cardiovascular disease. Even the latest, I have seen that night brushing can prevent gut problems.
Yeah.
It can improve gut health if you do a night brushing. And also it is linked to Alzheimer's, stroke, even lung disease. Also in pregnant patients, pregnancy in female patients, they have to take very good care of gum health during the pregnancy, because it is linked to low birth weight and even preterm birth.
All right. So dental implants have become very popular in simple terms, but how do they differ from traditional denture and bridges?
Yes, dental implants are generally considered the fixed treatment option.
Yeah.
So there is also another fixed treatment option is crown and bridges.
Yeah.
Yeah.
True.
So when you have, I'll give you a very simple example. When you have a single missing tooth, you will have adjacent two healthy teeth. So when you go for a crown and bridge procedure, you need to prepare those healthy tooth, and then you make it small, those teeth, and then you prepare, you make a bridge, and you replace that missing tooth. But when there is a dental implant is a root form, or it acts as a tooth root, which is placed into the alveolar bone, which is idle there, and then after the healing period, we give the crown over the implant.
Okay. It's a long procedure though.
Yes, it's a long procedure, but at the same time, we are preserving the healthy tooth.
Very true.
By checking the support of the
Yeah, because
bone.
they always say that whatever teeth you have, it's one of a kind.
Exactly.
It cannot be replaced no matter how advanced technology is, because at the end of the day, it is linked to nerves, and these nerves are irreplaceable, as they say.
Right.
So who is considered an ideal candidate for dental implants?
All adults with a very good oral hygiene and a healthy individual, good jawbone, and good soft tissues around the tooth or the missing areas. Basically, I would consider an ideal candidate for implant are those patients who would follow a meticulous oral hygiene after the implant therapy and who is ready to come for the follow-up.
Also, health problems has to be in place. Like if someone has, let's say, diabetes, they have to make sure that their diabetic level is on par before the surgery. Yeah.
Research, the latest research says that diabetes or osteoporosis, all these conditions, they are not absolute contraindication, they are relative contraindication. In fact, by consulting with their physicians, the patient's physicians, we can by drug holiday, or how we can alter the medications of the patients, and we can still go ahead with the dental treatment, and healing has shown improvement and good prognosis with dental implants.
All right. So how important is gum and bone health in general for long-term success of dental implants?
Very good question, because dental implant is a titanium surface which will osseointegrate in any bone. You place an implant, it osseointegrates, it stays in the bone.
True.
But what is the most important factor you need to look upon is there a sufficient bone and soft tissue around the implant? Minimum of 2 millimeter bone should be present around the implant when you place the implant. In case there is a deficiency of the implant or there is inadequate bone around the implant, or when you pre-plan the implant therapy, you need to explain to the patient that you need additional procedure like bone grafting and soft tissue grafting. Otherwise, dental implant is a very simple procedure, very predictable and safe procedure to replace a missing tooth.
Very true. I can attest to that because I have actually one teeth that I actually implanted, and I had to go through the procedure of actually doing a bone graft, and it was actually simple and easy. A little bit, I was a bit scared because of the sinus, because it was so close to the sinus.
Wonderful.
Yeah.
When you mentioned the sinus, even we have the latest imaging techniques like 3D and CBCT, where we can safely place implants by, planning well ahead before the implant therapy.
Any last message you would give to our dear viewers when it has to do in general about, going to the doctor and dentist in general?
In general, these are the main things. Brushing very well. Toothbrushing will cover the surface of the teeth. You need to clean interdentally. Interdental cleaning is by using a tooth floss or interdental brushes like interdental 8s. Interdental brushes comes in different diameters, from 0.4 to 1.2 millimeter. So your dentist will say you what type of tooth interdental brush you need to use based on the spaces. They are known as embrasure spaces, and not all the teeth needs dental floss. And it's like not all the teeth needs interdental brushes, and even water flosser is not for all the spaces or the tooth. Yeah. And thirdly, nutrition is very important. We actually concentrate more on macronutrients like carbohydrates, proteins, fats, but micronutrients like vitamins, B12, vitamin D, calcium, ferritin, magnesium, they're also very important for the oral health, gums and the bone. Yeah. And regular follow-up, 6 months visit is must. As I told you, hidden disease, maybe your periodontist can find out that you have a gum disease and you can save your tooth rather than having remove your tooth and place an implant. Exactly. Thank you so much for your time, Dr. Prashanthy, and we hope to actually see you in other shows like this, hopefully, and it was very informative. Thank you. Thank you so much. All right, dear viewers, all thanks to and appreciation to our guest, Dr. Prashanthy Prasad, a periodontist and implantologist right here in Kuwait. So, in the high valleys and fertile plains of Tajikistan, farming is more than a livelihood. It is a legacy passed down through generation. As climate change and modern agriculture pressures threaten the traditional crops, a quiet transformation is taking root. Farmers, scientists, and communities are working together to protect biodiversity, preserving native seeds that hold the key to food security, resilience, and sustainable development. Now, this report explores how small seeds are driving big change in Central Asia in Seeds of Change, Agro-Biodiversity in Tajikistan. Let's watch this report, and we'll be right back for more right here at Good Morning Kuwait.